This is Dr. Thomas Klein coming to you yet again, from Raleigh, North Carolina, bringing you news and reports and thoughts from the National Pain Council, whose goal it is to return all 7 million people who have been taken off their pain medicines without their consent, which legally is abandonment. I mean, every one of them could be sued. And to develop factual data in order to provide a counterpoint for what we're learning by the Big Trifecta, which is a DEA, CDC, and PROP, the Physicians for Responsible Opioid Prescribing. If you take those three out of the equation, there's nobody else that would be suggesting we stop treating pain. If you took all three of those out, there would be no problems. Heroin addicts would be treated. We only treat 20% because we think opiates are evil. In other countries where they offer treatment for 100%, not everybody goes, but at least you can offer it. Like in Portugal, their overdose deaths dropped 80%. So we supposedly have 100,000 overdose deaths, which is not true, and we're going to be talking about that in another YouTube video, that we would drop the overdose deaths from 100,000 to 20,000. All we got to do is provide treatment for heroin addicts. Simple. You read all this stuff about predicting whether or not somebody's going to overdose. You can't do that. How are you going to do that? Oh, they say there's risk factors. Oh, you go to more than one doctor, you're going to become a junkie. No, they've not shown that. But they pulled the wool over the eyes of state legislators who are paying $1 million a year to try to predict who's going to overdose or who's going to turn into a junkie. They've been at this now for 6 years, since the 2016 CDC guidelines. Guess what? More overdose deaths and the same number of addicts that have been the same since 1920. But I want to talk today about fear. What drove the Salem witch trials to hang people? Remember, they hung their neighbors. You got to really be afraid. And then there was the communist fear. I think I mentioned before, my father in the 50s was going to build a bomb shelter in our backyard. Fear of the communists had nothing to do with their ideology. It had to do with the fact they had nuclear weapons. That's why we were afraid. That's visceral fear, fear of death. So then we became afraid of HIV and AIDS. Why? Because we might catch it on a toilet seat and die. So then it was crack cocaine. Why are we afraid of black people going wild and killing white people? Fear of death. So what is the fear now? We have a fear of opiate pain medicines. It's best described in a little article that was written recently, which we can provide on request. It's called Narobia Syndrome. It's a physician's disease and a patient's misfortune. Prescriber's Narobia Syndrome, PNS, is professionally disabling neuropsychiatric malady. Remember, this is kind of a little tongue-in-cheek. It strikes physicians who, as medical students, wish to alleviate suffering and improve patients' well-being. Once afflicted with narcophobia, physicians become frustrated by patients in pain, treat them without compassion. Oh, you're just trying to score drugs. Physicians succumb to prescriber narcophobia early in practice and often for decades. Sometimes there are brief remissions when treating a malpractice attorney, hospital administrator, or someone who reminds them of themselves. So even though that's tongue-in-cheek about narcophobia, it is opiophobia or narcophobia or fear of pain medicines that is driving all the problems. This is why doctors end up in 20-year sentences in federal prison, because we're afraid that overprescribing causes more overdose deaths. But it's not true. And like I say, just me saying it is not going to solve the problem. We're going to show through our research when we publish little papers that it's not our opinion, that you can take our papers, look up the references yourself, and make your own decision. But it's fear. Now, fear has been induced into doctors when they hear of a fellow doctor who ended up being taken away in chains, as one woman physician was, in chains, and taken to the jail and processed and then released. And she is looking at a 20-year sentence. They keep delaying her trial. Meanwhile, none of her patients have the advantage of her skills. They make sure they get people off the street. That's what they did with me. They wanted me off the street. I was an older physician in my twilight years, as we overheard them say. And so older physicians, what do? Oh, they're just wild. They just prescribe to anybody who says I want an opiate. The interesting thing is, if that were true, it doesn't really make any difference, because opiate addiction is genetically driven. If you've had an opiate and did not addict, you will never addict, ever, to an opiate, any opiate, including heroin. So that's what the fear is based on. It's really based on fear of death, because what most people think the junkies do, they range the town with torches and pitchforks and kill people and invade homes. And actually, they don't do that. The people that do that are people on methamphetamine and cocaine. So let's understand that narcophobia is driving a lot of physicians to deny your treatment. And we are developing papers to help physicians realize they don't need to be afraid, since it's only older male solo practicing doctors that have all pain patients, because they have larger assets for civil forfeiture. So that's it for this evening. And remember, you can email us anytime at the National Pain Council, all one word, at gmail.com. Good evening.